everyone. Thank you so much for joining us. This is Madison Hammett with the Illinois ACEs Response Collaborative. We're going to get started in just a second. Going to give folks another second or so to roll in. Thank all of y'all for joining us first thing in the morning. We really appreciate it. Okay. Thank y'all so much again for joining us. My name is Madison Hammett. I am a policy analyst with the Illinois ACEs Response Collaborative. And hopefully we are all in the right place here today for advocacy and action to address ACEs in rural Appalachia with Adam Heggie and Denise Wynnum. We're going to go through a couple of intro slides to get started, and then I'll hand over the reins to Adam and Denise. The Illinois ACEs Response Collaborative is housed at Health and Medicine Policy Research Group in Chicago. Health and Medicine, as the name suggests, is a policy and research organization that works to improve the health of all people in Illinois by promoting health equity. And like I said, we are housed here, the Illinois ACEs Response Collaborative, and we really operate under three strategies: policy and advocacy, capacity building, and research, translation, and dissemination to operationalize our mission of catalyzing a movement to prevent trauma across the lifespan. And we hope that this will one day bring about a resilient and equitable Illinois in which individuals, families, and communities have access to resources they need to prevent trauma, heal, and thrive. And I am going to... Here we go. I just found out that none of y'all could see my screen, so apologies for that. So after the webinar, you are going to receive a short evaluation survey, some more information about how to participate with the collaborative, and a recording of this webinar. And you'll also receive contact information if the things here really resonate with you and you would like to learn more. So, during the webinar, you'll have the opportunity to ask questions. You'll see on the side of your screen there's a box. Please type those questions in. We'll be monitoring them throughout the webinar, and we'll go through them at the end with a Q&A with Adam and Denise. Just a little bit about our speakers. Adam Heggie is an assistant professor at Appalachian State University in the School of Public Health. His work focuses on health disparities in rural communities. And Denise Wynnum is a school social worker in Watauga County Schools. She's been one for over 20 years and is also the co-leader of the Watauga Compassionate Community Collaborative, which you're going to hear more about today. And thank you so much to Adam and Denise for joining us, like I said, first thing in the morning, and they are both at the end of their respective academic semesters, so we appreciate them taking the time. I am going to hand over control of the screen to y'all now. So, control. And Adam, you should be able to move forward in the slideshow now.
Okay, I'm trying here. It's not allowing me to move forward.
There we go. Okay. Trying now. Let's see.
Still not getting anything.
Okay. Well,
sorry.
There, I see you moving.
Yeah, I'm moving here. Oh, there we go. I think I did that.
Okay.
Well, everyone, it's such a pleasure and a privilege to get to be with you all this morning. We are so thankful for the invitation to speak with you all about what we have going on here in Watauga County, North Carolina. And as Madison said, I am Adam Heggie, and I'm here with Denise Wynnum. And we are here just to talk about what's been going on for the last 5 years here in Watauga County. Denise is going to talk a lot about the Compassionate Community Initiative and its history and where it's come from to where it's today. But to begin with, I'm going to just kind of give an overview of Watauga County and some of the key statistical indicators. And like I said, then I will turn it over to Denise and let her talk a lot more about the details around WCCI and the partnerships and the communities that have kind of come together. And then it'll come back to me and I'll talk some about the strengths, challenges, opportunities that we've experienced here that could be useful for you all in Illinois and beyond. All right, so just to give you a little background about Watauga County, North Carolina, we are in a beautiful location. We have a picture on here of the mountains. We are kind of in this location you can see with the red dot. We're kind of border Tennessee, and we also border Virginia to the north of us. So we're kind of this point in northwestern North Carolina that connects the states together. We are very much kind of a rural county, but we also have some suburban elements, with Boone being here and being a decent sized town here in this part of the state. But we're in south central portion of Appalachia region. And as some of you may know, last 2 years ago, actually, the University of Kentucky and the Robert Wood Johnson Foundation did a report on health disparities in this part of the country, in the Appalachian region. And two of the main areas that they really highlighted for health disparities and poor health outcomes, issues with social determinants of health, were the central portion of the Appalachian region and specifically the south central portion, which is where we're located at. As you can see here in Watauga County, we're home to a large regional public university, part of the UNC system, Appalachian State University. You may have seen that we play some pretty decent football. So that's one of the things that we're kind of known for here in this part of the state and region of the country. We have approximately close to 20,000 students, so we've experienced a lot of growth in recent years, which has been exciting for many people, but also challenging for some folks here in the community that have lived here for years. And so we'll probably talk a little bit about that later on as well. But Watauga County, the Boone area here where we're at, kind of serves as a leader central hub for what's referred to as the High Country. And the High Country of North Carolina really is basically where about 10 counties here in this northwestern part of the state kind of connect. And we kind of serve as the central hub where a lot of people come for shopping, for travel, tourism, those types of things. Like many of the counties in this part, we have very high poverty rates, and so we'll talk some about that. And we have numerous adverse social determinants of health that play a large role in this area. And as detailed by our most recent county health assessment by our local health department, the three main priorities and three main challenges facing our county right now are food insecurity, mental illness, and substance abuse. And so we can think about ACEs as being connected to all three of those very closely, not only for children, but their families and the community at large. Just some facts here to relay to you from the Census American Community Survey reports. You can see that we're a relatively small county in proportion to many other counties. We have just over 50,000 full-time residents here in our county. The median age is young, which is kind of has to do with it being a college town and those types of things. We have the median household income is roughly $41,500 a year, which we know is relatively low, right around the national level though as well. You can see that we have a very high rate of poverty, nearing 30% there. And you can imagine here where we're at in Appalachia, we're very much a predominantly white area. And so that's something to also highlight here in this area. And then if you look at the county health rankings report, some of the main statistics that we kind of pulled together for you all to see in relation to the rest of North Carolina, you can see that where mental health days over the past 30 days is higher here in our county. Frequent mental distress is higher. As I mentioned earlier, food insecurity tends to be a major issue, and there's a lot in this county right now going toward addressing the issue of food insecurity. And so we will probably touch on that later as well. We can see that uninsured children is a major issue. One of the things that I always like to highlight to my students and highlight to communities when I'm presenting is Watauga County is a unique county in terms of the income inequality. We are actually in the state of North Carolina, we have the highest ratio of income inequality. And a lot of what that comes from is we have a large chunk of our county has lived here for their entire life. So there's a lot of intergenerational poverty, intergenerational issues, but then we also serve as a major retirement location for many people from the South that move here for cooler temperatures during the summer. So we have a lot of Floridians that live here part of the time, and also folks that have second homes. And then we also have the university here and the hospital in our community being the large employers. And so incomes at those locations are much higher than the general population. You can see that we have a higher rate of excessive drinking, and kind of linked back to the income inequality is the severe housing cost burden is another major issue that we deal with here that is oftentimes associated with the income inequality. The building of houses and how that goes about with thinking about the income inequality issues. So just to kind of transition us toward ACEs, many of you are probably very familiar or beginning to become more familiar with the model that has been put out in recent years by Ellis and Dietz at George Washington University. And just to kind of introduce us into what we have going on here, we are actually starting to use many of these key components in terms of what we're doing here. We really have focused on a shared understanding of ACEs and the effects at the community level, and Denise is going to talk a lot more about that and where we've come from to where we are now. We really have focused a lot on building that sense of readiness and working on capacity building, bringing networks together. We're really focused on this development of innovative cross-sector partnerships, and we'll talk a lot about that today. And then it's been really exciting for me on a personal level, and I know Denise will talk about this, how much more the community is becoming engaged around the issue of ACEs and in developing these support systems and leadership that we need to have for us to thrive moving forward. And with that, I'm going to kind of transition to Denise and let her talk and tell you all about our collaborative here.
Good morning. Thank you for having us. So this actually came about after 20 years of practice. I decided to get a master's degree, and the person that I was doing an internship with had gone to a pretty major, almost statewide ACEs summit in another county. And when I was starting my internship, she said to me, "What do you know about ACEs?" And I knew nothing about ACEs. And so she said, "You need to learn, and I want you to bring that here. That's your internship." And so that was in the fall of 2016. And so got some people together, started learning more. It was one of those lightning bolt moments, not only for me because I come from a high level of trauma, but just after 20 years in the same system, seeing the same people over and over again and intergenerational everything. I think I had gotten to a point where I, was really questioning why people just don't do things differently and how long does it take to make a change. And so to learn about how ACEs impacts brain structure and all of those things was just kind of revolutionary for me. And so I caught fire pretty quickly, and I kind of feel like whoever's leading this has to be sort of on fire for it because it takes a lot of energy and effort and stamina to kind of bring everybody along. And so we decided to do a conference in the spring of that year, and I get these things in my head. I knew I wanted 400 people there, and the first 250 were easy to figure out who we were inviting, but the next 150 really challenged us to think about Boy Scout leaders and bus drivers and people we don't normally include in these conversations. And so we started planning. We did have 400 people there in the spring. I really thought that that was a one-time deal, and the response was so enormous and huge and fervent that we decided to create something that would be ongoing. So we've created a steering committee, And at our first meeting, there was about 60 people there, and it was everybody, you know, who needed to be at the table, the schools and churches and the university and youth serving agencies. And so we decided we would meet once a month. And I don't work in the summer, so we took the summers off. But when we came back in August, I said, we have to have a name, and it has to be something that people can shorten, because that's what they're going to be calling us for a long time. And so we started labeling ourselves pretty much immediately and came up with our name and our vision, and started our monthly meetings that now 3 years later not only continue, but we actually had to change locations because we outgrew the conference room at the Department of Social Services and had to move to a church, because we have between 60 and 80 people that attend. We meet every second Thursday, and we have about 80 people coming, and we broke into subcommittees, and so people could kind of work on things where their interests were. And so we decided to follow the Center for Disease Control, Essential for Childhood, that talks about community awareness, using data to inform solutions, and that's the model that we've tried to stick to. Do we need to, I don't know when we need to move. And so I've said some of this already, but so we broke into subcommittees: awareness, prevention, data, funding has kind of been absorbed, and policy and events. And events is who does the conference. And so we had our vision, and then as years have gone by, we've continued to do the conference, and actually started charging $25 a person, and really that was to cover the facilities and the programming, the lunch and that kind of thing. But last year we made a little bit of money, and we're able to hire a strategic planner to kind of help us formalize our leadership processes, and also create a mission and some maps with goals and objectives. And so we've tried to get some clarity and structure to our leadership team that way. Talked about the essentials for childhood. Try to kind of keep this as our North Star when you can kind of get bogged down in the weeds and the details. And so when you have 80 people in a room, there's so many ideas about what needs to be changed. And so we have to be careful not to take too much on at once, or not to take on things that are so huge. We had that experience for about a year where some of the committees took on things that were so huge, they just kind of sat and talked about what we needed to do. And we made a commitment at the beginning of this year to break things down into 3-month goals and to achieve those things within our timeline, so that we were continually moving forward and had momentum. And so we start talking about all the things we've accomplished. And when I look back, that it's only been, I guess, so this is 2016, 2019, like 3 years that we've been actively meeting. It seems like it's gone on much longer than that. But one of the things that came out in a meeting, and we have a first responder there who said, we'd like to have something on us so that when we have to leave people in a crisis, that we know that tomorrow, when the shock's starting to wear off, they have some resources. So we developed a card for them to carry with them to trauma scenes, so that they feel like they're just not leaving people with nothing, no kinds of supports. We created a WCCI display board. First thing we created actually was a presentation. It's a standard presentation. It's about 15 minutes, and then the Nadine Burke-Harris TED Talk adds another 15 minutes. And then we had the slides from the presentation printed and laminated. And so when you take the WCCI board somewhere, you can kind of match the slides to the interest of the audience that you have. And so we have a standard presentation. We're actually just training right now about 15 people to go out and do the presentation. It's primarily been me for the past couple years, and have given that presentation to over 500 people. And the demand now is so great for that, it's just going to take a fleet of us to make that happen. And so luckily for me, my system is really open to what the work that we're doing that's trickled over into our school system as well. And so we're constantly trying to bring people in to the movement, trying to bring people into the meetings, going out to where they are. We come back in February, we're going to present to a Rotary Club. We go to churches, and our first responder that comes to the meeting has been going to fire departments. And so we make a really active effort to ride that momentum of people requesting information from us and do that as the requests come in so that we're not making people wait. And then part of the presentation through our data committee that we have is that those all would be tracked and shared with acesconnection.com and also kept locally so that we can look at kind of where our influence has spread and where are the pockets that we're reaching and maybe what are the gaps that we still need to address. And we have, it's a privilege and an asset for sure to have Appalachian State here. And so several professors come to our meeting. We have representation from the social work department, from public health, from the human development and psychological counseling department. And so people who are interested in this in their classes, in their research, that's been really helpful for us as far as spreading our influence. So one thing that was really interesting, one of the people, so Adam is the lead, co-lead of the data subcommittee, and another person's Kelly Reed Ashcraft, who's a social work professor. And a year ago, they decided they wanted to measure the ACEs scores of WCCI and resiliency scores. And just a personal side note is I knew my ACE score was high and I never wanted to do it because I really didn't want to know how high it was. But when we all decided to do it together as a group, I did it. And it's a 9 out of 10. And so I had firsthand experience of someone learning what their ACE score is and what that means and how that changes how you view yourself instantaneously. And so I went from this really driven, self-judgmental person to like, look, we got up today. We're out of bed. Good job. And so it really changed not only how I view clients and colleagues, but myself as well. And so that was a really powerful experience for us. And they are right now currently doing the year follow-up to that as well. And I really like that we try to always talk about resiliency with trauma. And even in the school system where we're recently finished training every single one of our schools with a compassionate schools model, you know, the teachers say, we can't do anything about the trauma, but we can help to build the resiliency. And so that's a focus of us as well. I'm not a grant writer, but we have several people who are, and so written several grants that have not come through, and then just recently got one that was approved, so that was exciting. It's a small one. The big, huge ACEs thing that happened in North Carolina in Buncombe County, which is where Asheville is, they had a $2 million grant a few years ago. And I went down there to visit and talk to them, and I said, what's your biggest regret? And they said, well, you know, that we started this with a grant, because now the grant's ending, we have to figure out how to move forward. And so that's one thing that I really love about what we're doing, is that we didn't start with a grant. And everything that we've done so far has been really riding on people's passion and heart and motivation, and everything's volunteer. We don't have a paid director. There is no source of income or funding, and still the work continues to happen. We do get donations from businesses and groups to support the conference, which takes about $12,000 a year to put on. When I started the first one, somebody said to me, you don't have any money for that. And I was like, my whole life, I'm a social worker. My whole life I've been doing things without money, personally and professionally. So we just really, I think sometimes you don't know what you don't know. So we went into that without any income, and it's still managed to get a lot done. And so our attendance has grown with the conference from 400 to 600. And we actually are now located at the high school where we have classrooms. So we give classes during the conference, and have settled on a weekend. We're going to try to do that every year. So I'm going to try to fly through some of these because I know I'm talking a long time, but so trauma-informed schools, compassionate schools project I've mentioned, support from all the principals and director of student services and the superintendent. We've developed a 3-hour training course based on the book, The Heart of Learning from Washington State. And so all of our schools have been trained in that. We're looking at kind of what's going to be our step 2 or phase 2 for us in that area. The faith community is heavily involved in this, at presenting at the conference and attending the conference. High Country United Way has changed the language of their grant program. so that applications refer to, priority given to people who have a trauma-informed focus. And so I'm gonna hand it back to Adam.
All right, and I'll come back and just share some of our strengths and challenges and kind of our next steps to kind of build upon and just kind of wrap up a lot of what Denise said, which I just think is incredible. But some of the strengths that we've had here that we've really experienced is this idea of powerful change happening when people come together. And I know a lot of other communities have experienced that, but we just feel like here in this rural Appalachia community that it's just been exciting to watch that and see the long-term commitments, see people that have lived here their entire lives and worked here come together with people like myself that are newbies, outsiders to the community, and see how we can all come together to really make our community stronger and help families for the future. As one of the co-leaders, Denise Presnell, who is here with us today, and Crystal Kelly, another of our co-leaders, they're both just incredible human beings, and they're both inclusive, they're collaborative, they communicate well, they recognize the skill sets of themselves, recognize what they're not skilled at, and really work well as a team and really help us to all kind of find our skill sets and how we can all plug in to help. Another key strength that we've had is this continued growth of the interdisciplinary perspective. I know that we all in academia and in the real world talk about this, but to actually take a step back and look at how important that is and how it leads to such stronger problem-solving abilities is quite remarkable. And we've really created a culture here in Watauga County with the WCCI initiative that everyone's voice matters, and we're really starting to pursue that more and more with people from the local community who are maybe not attached to one of our agencies or who is at high risk for ACEs and those types of things. So there's a lot of movement toward including more voices and trying to bring more voices into the equation. Data, being a public health researcher myself, data-driven approaches and the ability to use data to guide decision making is vitally important, and it's really helped us to track, our outcomes, short-term, mid-term, long-term, and we're continuing to try to figure out how to do that better. But it allows you to really set good goals. As Denise has already mentioned, we get caught up a lot in funding and always needing funding. And for our initiative here, funding is not really something that we're overly pursuing. It's not, if something comes along, that's great, but we're just passionate people, and funding does not have to be a deterrent. I know a lot of groups that I've worked with look for any and all funding and spend most of their time pursuing that, and that can take away from actually doing the work. And so I think that's vitally important here. And then we've also experienced that university community partnerships offer a good strategy for sharing of resources. It's, we're a large public university, as I mentioned, so our responsibility really is to take care of our community and to serve our community. And I really, as a faculty member and many of my other colleagues, we take that to heart, and we're members of this community, and we want to see this community be what it can be. And there's things here at the university that we lack, and we need to reach out to the community for further support. And the same can be said about the other. There's, the community lacks some resources, and the university can provide that. So it's a really good working relationship with WCCI between the university and community. As with all initiatives and collaboratives, we've experienced our fair share of challenges and barriers and things that we're continuing to try to work toward. As Denise mentioned earlier this fall, we really, with this extra money that we had, hiring an outside consultant to really sit down with us and think about the strategic plan, kind of the long term. Where do we see Watauga County in 10, 20 years down the road? How do we get us in that direction? So really looking at some of those longer overarching goals and trying to work backwards to make that flow properly. Goals to guide our data collection. Is a data junkie, is a researcher. Data collection is not always the easiest thing, and in deciding what data needs to be collected, how is it going to help WCCI move forward? I think this is a challenge that we face, coming from the academic side of things, that we oftentimes don't take the time to do a good enough job of really making critical decisions about what data is important and how can the data actually be used in the real world to impact change and to improve the human condition. That data shouldn't just be collected for data research purposes. It has to have a community impact purpose. Challenges, barriers, time commitment. So we're all working full-time jobs. We're doing this voluntarily just because we care about our community, care about people, but that can become burdensome, and we all have to make sure that we're taking self-care and taking care of each other. The lack of staff support to be able to organize things and to really keep everyone in check, and that can be challenging. As I said, funding does not have to be a deterrent, but also funding can be a challenge in terms of when you're wanting to try to improve your reach and those types of things. So funding can be a challenge as well. And then the misalignment of systems. So we are all doing great work as individuals, as agencies, but really trying to get that system of agencies and individuals working collaboratively, communicating properly. All of those types of things are challenging. And from a research perspective, that is something that I get really excited about. I get really excited about studying and taking a step back and looking at the public health system. But that's a challenge. Prevention efforts with any ACEs collaborative. I think we oftentimes we go to the more midstream, downstream effects, which is vitally important, but we also sometimes struggle to really go more upstream and get to some of those primary prevention efforts because we have to respond to the immediate. And so it can be challenging to do all the multiple levels of prevention. And we also know from public health and social work fields that primary prevention is not what we typically do. We're typically under-resourced and undervalued when it comes to the grand scheme of things. Grassroots efforts, they provide a lot of energy. They get things kicked off. They get everyone excited. But it can also lead to a lot of chaos and a lot of people not knowing where they're needed the most, where should their efforts be placed, and role clarity is something that we've been really trying to address in the last few months as well. And as I mentioned earlier, getting more voices involved, getting more community members involved outside of just the professional disciplines, because every community member has a story and a voice that they can share that can be a part of the equation and can help us to do our job better. So that's something else that we're facing and trying to take on in the coming months. So just to kind of wrap us up with our material, and we look forward to having discussion and questions, but our future goals and directions that we've really decided upon this year and moving forward is really trying more and more to move upstream in our thinking and action. As I mentioned, that can be challenging because funding and our attention has to be placed on kind of the mid and downstream, but we really want to try to, in our thinking, to get us moving toward those upstream effects, because we know from public health and social work that those will have the most impact collectively. We want to have more and more involvement in advocacy and communication with elected officials and policymakers, because we know that policies and systems really help to drive a lot of what we do. And so we have to engage in the advocacy and communication. And we are very fortunate here in North Carolina right now of having a governor that's very forward thinking in terms of children and schools and all of those things. So I think it's an opportunity for us to take advantage of. We also have one elected official here in our community that's very much dedicated to that as well. And so just more and more communication with our local elected officials and policymakers can go a long way. We are constantly seeking more active participation from the medical community. We've heard this from a lot of other ACEs collaboratives that getting that engagement from the medical side of things is very challenging because their work entails them working on individuals and working on patients, and doesn't allow them the time and energy to direct at issues related to ACEs. So we're really trying to involve more of our local pediatricians or their healthcare providers. Denise can speak to this. She's gained a lot of momentum with the local hospital here, and so we're excited about that. We've got more and more pediatricians getting on board, so we've got to keep pushing that forward. As an academic and working in an academic setting, we have access to resources as it comes to funding opportunities, so we've got to continue to seek out things that strategically that can help us to expand the current work, while also being strategic in terms of our seeking of funding opportunities. And one of my goals, and I think goals collectively, is more of a commitment from the university. As a university faculty member, I want to see more and more commitment from our university as a whole and faculty staff resources toward the work of ACEs in our community and trying to respond and prevent trauma. So I think that's something that we're all going to be pursuing as well. And with that, that's our presentation, but we look forward to engaging in discussion, questions, and look forward to hearing from you all.
Thank you all so much. Folks, if you have questions, please type those into the box that you see on the side. And, we've got some coming in, and while those are coming in, I'm going to get us started a little bit. So I was wondering if y'all could talk a little bit more about your data collection process and how that works for the different stakeholders you have. I know a lot of our members are bringing folks together from several different types of fields or several different backgrounds, and you talked a little bit about how these grassroots things can be a little chaotic because folks are trying to figure out what the priorities are. So I'm wondering if you can talk a little bit more about how did you actually get those priorities aligned?
So as Denise mentioned earlier this year, we had a retreat, and this is one of the things that we really were struggling with, is the data collection, because we as faculty members in the university, this is what we're trained in. We're trained in collecting data, analyzing data, but the challenge is oftentimes, what do people need? And people working in the community, oftentimes it's hard for them to take a step back and realize, what do they need? So we really try to take this approach of looking at what can we collect and manage that can help us in the short term, midterm, and long term. And so we're really focused in the short term more of keeping track of how many presentations are being made, where are they being made at, those types of things. So so our audience, and so who we are reaching out to. So we're really trying to track those things in terms of our reach. And we know that hopefully in the midterm from that, the data that we'll be tracking and working with many of our agencies is, how is that affecting their practice? How is that affecting their policies and procedures? Are we seeing change with that as a response to people being more aware of the issue of ACEs and its effect on their community? And then long term, kind of thinking upstream, how can we, as one of our folks here talks about moving the needle, how can we move the needle toward where we're starting to see some changes in some of those root causes, social determinants of health? So we'll be tracking, we plan to start tracking more vigorously around housing concerns, food security, some of those type of areas. So we're really starting to reach out as well to some agencies and portions of our community that we hadn't reached out to prior to. So we're trying to become more coordinated with our data collection, but data collection is challenging in itself.
Definitely. And this kind of goes along with that question of having folks from lots of different backgrounds. It sounds like y'all got a lot of engagement from a lot of different types of organizations and different sectors, but I'm wondering if you can talk more about what barriers you faced in terms of people's responses. Were people like, oh, this makes a lot of sense and we appreciate this knowledge and want to utilize it, or were there some groups or folks that were like, this doesn't really have any, I'm a food bank, I can't worry about this right now, I've got other things that I have to prioritize? And if so, how did y'all overcome those barriers or address them?
So this is Denise. When a very wise man who's my supervisor, so don't tell him I said that, but at the beginning of all this, he said, we're going to work with who comes to the table, and that's where we start. And when I went to Buncombe to look at their trauma-informed schools, and I said, you know, did you force every teacher in the building to take on this mission? And he said, you know, that it doesn't work that way. The spreading of change happens when you bring in those people who are passionate, and then you hope word spreads. And those two things really stuck with me. So for one thing, I'm extremely driven and persistent and have a lot of stamina. And so we've made note of who's not on board. And when you say, where are your gaps? We know it's the hospital system. We know at one point it was law enforcement. We know it's a little community in our county that's a little more isolated from us. And so those places stay in our minds. And I think another thing that's huge is that I had done work in this system for 20 years, 24 by the time this all really started happening. And I had never really asked anybody for anything. And so I personally, so don't use emails. That's a big thing. I personally went around to 400 people and said, we need you in this. We need your voice. We need your experience. And so I think from the beginning, you know, when you're reaching out to people personally and making a plea for them because it's the right thing to do, your question of when people hear it, do they make sense? My experience of this lightning bolt moment, I think, is really common for people, whether it's teachers or law enforcement or medical. You do the presentation or you tell the story, and it's a light bulb moment for people. And you know, all these questions we've had about why is that person reacting to me like this is really just very clear. And so that's been an emphasis for us since the beginning. Was we do things through personal relationships and conversations. And so we personally invite 600 people to come to the conference. We personally invite people to come to the meetings. And so it's an emphasis of ours that we get people engaged and that we want everyone there, and that it's not just a service provider thing. It's not just an early childhood initiative. It's a lifespan issue. And so it's just been one of our foundations that we build on the relationships that we have, and we continue to bring in people who are passionate and want to do the work.
Great, thank you. Some folks wanted to know, could you provide more details in the level of engagement of the university and how they've played a role in the education sphere of practitioners and the community as a whole?
Adam might have something to add to this, but Kelly Reed Ashcraft was one of the people. She's the other lead for the data committee. She was involved from the beginning. And so when we did the first conference, we deliberately planned 20 work groups, and we did the composition ourselves based on the guest list so that there was a little bit of everybody in every room, and said, in an ideal community, what would it take to more effectively prevent, recognize, and treat trauma? And I wanted a facilitator in every room. So again, personally invited 20 people from the university or therapists from the community who were experienced in group facilitation. And so have just been inclusive of them since the beginning. And that gave us a lot of data about, you know, changes that we need to make and stuff. And then that pool of people connected to the university has continued to grow. Then Adam came, and 2 or 3 more social work professors, and some people from human development and psychological counseling. And so just considered them part of the community from the beginning. And I think the same philosophy of you find the ones who have the passion and you bring them into the fold. And so that has been my experience about getting the community involved, or the university. And then I'll let Adam add to that.
So I'll add on to it from the academic side. One of the most exciting and rewarding things that I've experienced in the last couple of years is seeing students that I've had in the classroom go to work for our local agencies and be involved in ACE's work. And probably one of the most rewarding things I've experienced from this is one of my former students went to work for the local health department, and she took it as well to another surrounding county. And so she is leading an ACEs initiative in another surrounding local county. So to see her take on that leadership as a young professional because of her passion for this. And so that's been exciting to see. I'll go to WCCI meetings, I'll be out in the community and see students that I've had in the classroom out there working in the field and us keeping in contact and working together. And then also we've been excited because many of us faculty members in public health and social work in particular are engaged in the work of WCCI. We want to train our students to be prepared to go to work in the realm of ACEs and trauma. And so this past semester, I had the great fortune, Dr. Kelly Reed Ashcraft, who's already been mentioned, she helped us to develop a course on campus that was an interprofessional course between public health, social work, and nursing students to train them in an interdisciplinary, interprofessional way how to work with individuals, how to work with families, how to work with communities around ACEs. So we know now that they've been exposed to this, had this training education, that they're going to be able to work here in our community, but also to be able to go to other communities and to take that knowledge and use it other places. They did a lot of work. Several of our classes have also done a lot of service projects in the community, research projects, so getting them outside of the classroom, out into the community to experience these things and to be connected to local professionals is so exciting. So this kind of great professor, community practitioner, student mentoring relationships that are being developed are just so rewarding and so great to see.
Thank you. And you touched on this a little bit with telling us about a student who went on to another county and did this work. And so sort of related to that, I know a lot of our rural members have talked about feeling like, oh, I'm the only person in this area who's working on this, or like, you know, I'm very isolated in my county. It's, you know, an hour away until the next town and that sort of thing. And so I'm wondering if you can talk a little bit more about joining forces, so to speak, or if you've been able to collaborate and learn from your neighbors or other rural areas around you.
So, like Adam said at the beginning, we're a bigger county for our like surrounding 6 or 7 counties. And so it's interesting you're asking this question. 2 of the counties beside us that are very small had said in the beginning, we can't do this, there's not enough people here. One of them asked me to come over there and do our presentation with a group that they had over there and talk about the work that we had done and how we got started. And even though, you know, there was those 3 or 4 sitting in the room shaking their head going, we can't do this, we're too small, there's not enough people to make this happen. They're now in their 3rd year, I think, of planning their 3rd conference. And so it really, I think it's more about, do you have someone to lead who's really passionate and driven and tenacious and persistent? And can they find those people in the community who are also passionate and driven? And can you bring those people together in a team? And then can you sustain the momentum? Because I know in places where we've heard of where leadership changed and the next person that took over, things kind of fall by the wayside or disband or dilute. And so, but I do know in a couple, 3 of the very small counties that have come to hear what we're doing, 2 or 3 of them might group together and then try to do some things jointly, or go to another county where it's happening. So our conference that we do is not just for Watauga County. We have people coming from Alexander County, Lincolnton, as you know, far away as 3 or 4 hours from here, because again, with the inclusive,ness, we want to get people here as much as possible to spread the word. So if some of those smaller counties have said to us, we don't know how to get started, they're welcome to come to a WCCI meeting. We're happy to talk to them on the phone about what we've done. They can come to a conference. And so I think it's possible to do, but you have to, I believe everything is a continuum and is unique to who you are. You have to figure out what works best for you based on your leadership and your pool and doing what you think is going to be effective.
Thank you. So look and see if we've got any more questions coming in, but I do want to be respectful of y'all's time. Thank y'all so much for joining us. Again, it's early in the morning, and also for at the end of y'all's semesters, I'm sure you have a ton of work, but we really do appreciate hearing from folks who have been able to do this work in a rural setting, but also, as you said, do it without funding, do it with, just from their own passion. So we thank you all so much. Folks who have joined us, you will receive a recording of this as well as the materials and a follow-up email, and it will have all of our contact information. So please, if you have some follow-up questions, feel free to reach out. And Adam and Denise, thank you again so much. And
thank you for having us.
Thank you for having us. Yes.
We appreciate it. So thank y'all for joining us, and have a wonderful new year. And we will have our webinar series continuing in 2020. So thank you.
Thank you.
Thank you.